I came to politics from science. I published in an amazingly interesting field. It's in neuroscience, but I published on post-surgical abdominal adhesions. I'm sure you've all read my papers. Politicians, when I got into politics, I thought about the fact that cities are actually a more capable place of changing the healthcare paradigm than science. People aren't going to read my papers. What they're going to do is be able to walk to their work and use public transportation. I also thought about the mass amounts of data that everybody's collecting. And I tend to think about the decision-making that goes on with politics and the fact that it's not hypothesis-based. When I got into politics, it was very NIMBY-oriented. And it was very, who met me on the steps, who challenged what decision I was going to make that day. It wasn't very data-driven. And it really drove me crazy that the paradigm in my council was, don't bring up a chart. There's no pie charts. You better bring a pie because people don't understand that sort of decision-making. I wonder what it would be like if more data-driven decisions were decided like scientific experiments, where we could actually have a question before we collect data instead of just collecting mass amounts of data. So I'd like to introduce Jennifer James. She's from the Smart Cities Solutions leader. She's a leader at Black & Veatch. And Scott Rourke, Chief Information and Transformation Officer at Cuyahoga County. So I'm going to let them introduce themselves, and then we'll get into some questions.
Hi, everyone, and great introduction. I like both kinds of pie, just for the record. So I'm with Black & Veatch, and we're an engineering company, and we've been around for over 100 years. We focus on infrastructure systems within cities, energy, water, telecommunications, and increasingly smart distributed infrastructure assets. And one thing that became really clear to us several years ago is that the nature of infrastructure was changing. It was getting more connected at the same time as it was getting much more distributed. And we realized that data was becoming a new currency of the future and invested pretty heavily in an initiative, a new business line actually called Smart Integrated Infrastructure. So the title of this panel talks about smart, it talks about data-driven, and it talks about taking a systems perspective. And Smart Integrated Infrastructure is really about that. And we not only focus on the deployment of infrastructure systems, but also leveraging the data coming from them to do things from all the way through from planning and road mapping to helping drive better implementation and operations. An example of that I'm actually really thrilled to be announcing and launching here at Meeting of the Minds is a tool and a framework that it's called CityGauge, and we've developed it with our partners from Rethink Advisors, who I think are generally over there, and the president being from right here in Cleveland. And also in conjunction with the city of Lakewood, Ohio, we've really taken, if you could pull up this screen, taken a look at what can it mean to take this more holistic view and a more structured view of how city systems or city health, city well-being is measured and then changed ultimately. So the top screen there is really, you can't see it well here. We have it, we're giving demos at our table later. But it's really a way of scoring across a whole bunch of different metrics, from livability to health and well-being to mobility to energy infrastructure, resource regeneration. And it kind of steps through all these different components of a smart city, I should say, of a smart, sustainable city system. So taking it from using data sources, including human data sources, to really measure how well a city is doing as a system, connect the dots between those systems, and then be able to drive better decisions based on them. So that's just one example of what I'd call an attempt at a much more systems perspective and a data-driven perspective.
Scott?
Good afternoon, or probably morning. Hi, I'm Scott. I'm a tech entrepreneur. I've been through venture. I have built a variety of tech companies, run some big tech companies, done some large industrial business turnarounds, and the last 15 years here in Cleveland have been a social entrepreneur working on economic development in the tech industry. I started about 15 years ago a nonprofit called One Community with many of my comrades in arms are joining us here today. As the founding CEO, we built up a nonprofit, and the vision was to build kind of the platform. We wanted data and applications, but we knew we needed to start with infrastructure, assets perhaps. So we built a fiber optic network. We connecting really a big, large region, about 16 counties. With no startup money, we actually built it and raised ultimately well over $100 million, connected thousands of schools, libraries, figured out a lot of different ways to do pilots and accelerate the adoption of technology. And I was really satisfied with, in healthcare, our local public hospital became the first to go paperless. In education, our schools, their graduation rate grew by double digit. They attribute that primarily to we provided a CIO, we did tens of thousands of computers and really built them up. But in government, we were not as satisfied. So even though thousands of institutions engage in government, that was still an area to be challenging. So I took the privilege and honor to join county government, Cuyahoga County, the largest county in Ohio. We've got about 8,000 employees, $1.5 billion in revenue, and it is a target as far as government transformation using technology. It is target rich, and I will leave it at that.
That was an absolutely excellent initiative. And, that initiative really connected government with schools, with infrastructure projects, and was a fantastic ability to connect the community and be able to collect that data. And again, I want to ask the question, Google and most major corporations are now entering the city building with Google announcing that they're now building a neighborhood in Toronto just the other day. I'm really interested in the amount of data that is being collected. And again, it's being able to agglomerate that data and collect it and then make meaning out of it. It seems like the future is really in data scientists and being able to train our kids to be able to read large data sets and then make meaning of it. How do you implement change from that data that you collect?
I can start. I think it's a really good point. I think you need to start with what you're trying to accomplish. So a big part of the reason why we felt it was important to have a decision-making framework is it relates back to specific goals that relate to the purpose of that community. And for every community, it's going to be a little bit different. So if you think about outcomes, think about, first of all, what outcomes do you want? Then be able to relate projects and programs to things that can move those outcomes. But it doesn't stop there. It actually also means you have to measure and see whether those outcomes were actually produced. Unfortunately, we're in a world where we are getting those types of data. So it's not just looking at what we want to accomplish and mapping it out and relating projects to programs, projects to goals. It's about making sure they actually achieve those goals and getting feedback and being able to adapt all along the way. So it's really kind of a cycle, the whole process is. So the other part of that, you mentioned the people side of things as opposed to it being just purely about data for data's sake. And so it's really important, and I know that the City of Lakewood takes the whole community engagement and getting communities' input into what matters most to them. And so I think infusing the human element when you're really setting objectives and being able to communicate progress to those same key stakeholder groups, that's really important in order to keep changing the dial.
Hi, I would say we started with, so I've been there almost 2 years now. We started with getting our internal data in order as best we could. So I'm going to use acronyms as a forewarning. So we've kicked off ERP, EAM, asset management, CRM, CMS, document management, integrated case management, and so on. So we have tens of millions of dollars of systems replacing 1987 disparate systems, all done in silos by competing political factions that are now integrated, or at least sitting next to each other, all in the same building now. So a terrific opportunity to get our data organized. It will take it will take some time to do that. We also have a wealth we spend hundreds of millions with nonprofits, so don't forget about them, their data, and they're doing the programs, and we're trying to get everybody outcome oriented. You've got the state, which actually funds, the state and the feds do a lot of funding, so actually it's a fascinating discussion talking about who owns the citizen data. From a privacy and a security perspective, who's responsible for the data? So again, we focused internally, including the state, which we're the biggest administrator in the state of social services programs. We're trying to work with our hospitals, our cities. But as it relates to the opportunity, enormous opportunity. So think about just mental health and kind of the convergence of mental and physical health. So our courts are really the first, they often, most of the folks they see, or many of the folks they see have mental health issues. Well, they're afraid of putting people on the streets, so they'll send them to the world's most expensive emergency room visit, which is in my jails. So over 1,000 people every day with mental health are admitted into our jails. Of course, we don't have great access to the healthcare data from either the courts or the hospitals. So all sorts of opportunities there. But then when you think, if you keep going down the line, so we've got social services that we then administer. We've got the hospitals. There's many of these folks are tied into the public education system, big burden on public education. So all these are cylinders of excellence, we like to call them, all with an opportunity, but they all have disparate data sources, huge governance problems, probably quality problems, systems challenges. And frankly, the public sector is not well equipped to get the kind of skills like data scientists to afford people that can make over $100,000. There's a big barrier of those. So I see plenty of challenges, and I'm excited to see in the future how the private sector can inform the priorities of the public sector, help build capacity for the public sector. We need to address these privacy, and perhaps the private sector needs to demand somehow that we address how we, across political subdivisions, share data, because it's unlikely to be driven by the public sector, in my opinion. So lots of challenges and opportunities. The big data and the money of, just think about the prevention of keeping people out of our jails, of keeping people out of hospitals. The prevention dollars are unparalleled compared to the small investment it would take to solve and address this problem.
Scott, you mentioned something that's really interesting to me is access to healthcare data. And I know in our district, there's a huge disparity between our urban environments and our rural environments as far as access to healthcare data that can actually affect the livability of your community and your neighborhood. And preventable disease like asthma, which is air quality statistics, and diabetes, which is something that can be prevented with walkability and access to work and transit hubs and last mile walking. I wonder about the integration with government resources, private companies, and being able to access and make meaning of healthcare data. Do you think that in the future that this is going to open up and we'll be able to have better access to healthcare data?
I think that it will definitely move that direction. Right now we're looking at, one thing that's hard is best practices and doing return on investments and the social outcomes. So we've been exploring, San Diego is probably my favorite example so far, but they've actually done this, they've done the data, and they've actually focused on and have a good articulation of behaviors they're trying to address, like obesity is one of 4, and then they've done a decent job quantifying the benefits of that in a prevention strategy. So we've actually introduced some of those talents into our Health and Human Services area, which is about a $300 million budget, 2,300 people. So we continue to evangelize and educate and create opportunities and then align our budgets in cooperation with the state on doing something ambitious in this area.
Thank you. And Jennifer, you also mentioned something really interesting is how do you benchmark the outcomes? And Black & Veatch is doing some really interesting work in that area. Can you expand on that?
Yeah, I think that, to go back to what you're saying, you're both saying in terms of healthcare data, and the fact that all of these things, they impact so many other parts of the system. So you can't look at, air quality without thinking about the implications on healthcare. Well, think about all the ways you can affect air quality, and that relates to energy, relates to mobility. The point being that all of these different systems are interconnected. And so what we've been really trying to strive for is not just figure out what are the different key performance indicators or key outcomes you want to achieve, how they relate to very specific, quantifiable, measurable data sources, but also what is the relationship between the different things? How do you if you dial down, or you dial up, I should say, air quality, what would the implications be for healthcare, and what would the implications be for other aspects of the system? And that's a really challenging thing, and I know there are lots of research that are looking at those things from an overall perspective, but it gets really interesting when you get down to a specific community perspective. Also want to throw out there too some of the additional sources of data we have right now that relate to those systems. Like for instance, I know, I think we have Civic Smartscapes over there somewhere, and I'm sure there are other companies that are providing some really interesting sensors that are attached to street infrastructure systems that can measure things like air quality, and it can measure many integrated things. So there are other data sources that aren't just coming out of the health data, but can very much need to be measured and integrated to get that whole picture.
So at what point do we say we know enough? You know, we know enough. We know that we need walkable cities. We know that we need healthy water. We know that we need internet connectivity. And when do we get to the point that we stop collecting data and analyzing data and actually start using these resources to implement systems and change government's minds? How is the integration with government officials and decision makers and budgets done better through your resources?
Well, I could say, I know if Bob Bennett is out there somewhere, he would say that there's, from Kansas City, Missouri, he would say that we already have way too much, we already have plenty of data to accomplish what we need to accomplish. It's about making use of that data, and you're right, implementing programs, because the point is, if you don't actually implement anything, it is just data analysis for the sake of data analysis, and it really has no impact. So I think the important thing is to think about how data, it's not just being collected and analyzed and studied, but it's actually driving very specific programs and gives city officials more information, more justification to be able to put forward, not just through the budgeting process, but also to be able to bring forward to potential financiers or funders of these types of infrastructure projects. And also to be able to bring forward and interact with community members and get their input and feedback and get them on board. So moving as quickly as possible from just analyzing how things are, how you're doing, to what are the things that could impact that, and being able to use data to justify, to actually drive decisions. And of course, throughout the implementation process as well, which we also can streamline many things about how we implement and deploy infrastructure systems if we're using the data coming off of those systems as we're actually in the field. So.
I would say it's the data isn't that important to me. It's the more important piece is that every community comes together with strong leadership and focuses on the kind of outcomes and performances that they want to see. So I think it needs to come from broad leadership, public and private, and that we need to pick on what are our priorities as a region, whether it's opioids or better health or better coordinated care. Every community is different on how fragmented they are or aren't. But I think the key is really regional leadership. The private sector needs to, their role in data is overpronounced because they're going to have to lead on the data. They've got the skills, they've got the vision, they're 10 or 20 years ahead of the public sector's use of data. And so they're going to have to help lead by example and educate and resource some of it. The universities have data capabilities that it's unlikely to see in state and local government for certain. So again, it's about the data is just is just how we track the performance. But the key indicator is focusing, it's kind of the collective impact you've probably heard. It's getting everybody to focus on, okay, we're going to do the schools, and everybody defines clearly what they're working on and what they're not working on so that we can be far more effective and accountable, do more with less, and get to the outcomes that we all desire at the end.
I really love that. I really think that you both have addressed, talking about more neighborhood-based data collection and social infrastructure and cultural change, and how data can drive change in neighborhoods. So thank you very much for having us on the panel.